Oklahoma faces a major mental health problem. The state has some of the highest rates of mental illness in the country, but attitudes about the disease, coupled with a lack of resources, means thousands of patients are not getting the help they need.
Journal record editor Ted Struley is very familiar with the face of mental illness. Struley's son, Colby, died last year at the age of 28 after a decade-long struggle with schizophrenia and paranoia. Struley says when Colby began showing signs of mental illness at the age of 18, he was unsure where to turn.
One of the problems with mental illness is people are not inclined to talk about it. If they have a relative with cancer, they'll tell you. If they have a relative with schizophrenia, nobody mentions it. And so there isn't that social dialogue that there is with other diseases about this is where you go, this is who you see, this is the right hospital, the right doctor. You just don't know that.
Struley believes mental illness carries a stigma that makes people treat it differently from diseases like cancer or emphysema.
If you have a relative who is afflicted with one of those diseases, other people feel empathy, they ask what they can do to help, they bring casseroles, right? If you tell them that your child is afflicted with schizophrenia or bipolar or major depression, they don't bring casseroles. They stop coming to your house.
Colby's death inspired Struley to organize Freeze Your Face Off, a series of weekend events to raise awareness about mental health. Terry White is the commissioner for the Oklahoma Department of Mental Health and Substance Abuse Services. She says the state has the second highest rate of mental illness in the nation.
21% of Oklahomans in any given year struggle with a mental health issue, and 11 to 12% struggle with a substance abuse issue. What that means, because a lot of times we use percentages, what that means in terms of numbers is between 700 and 950,000 of our family, of our friends, and of our coworkers are struggling.
White says the high rates of mental illness should come as no surprise, considering the state's consistently poor health rankings in most other categories.
In fact, what would be really bizarre is if we had these really healthy brains, we had these low rates of mental illness and addiction, so we had these really healthy brains trapped in these really unhealthy bodies. But because we're not a healthy population, the brain is an organ just like any other organ, and we have high rates of those diseases.
Tracy Cook is the executive director of the National Alliance on Mental Illness, or NAMI, Oklahoma. Cook says while 1 in 4 Oklahomans suffers from some form of mental illness or addiction, fewer than half seek treatment.
They don't go to treatment for a variety of reasons, whether it's access, it's stigma. People are afraid, they don't understand that there's treatment out there, it works. You don't have to be embarrassed about going to counseling or taking a medication that you may need for your brain disorder.
State Board of Health President Dr. Murali Krishna points to another factor, a critical shortage of mental health care providers.
We don't have enough psychiatrists. We don't have enough qualified good therapists. There are not enough of them. People have to wait for weeks and months sometimes to get their medication refilled.
Funding, or the lack of it, is a major part of the problem.
We make decisions how to tackle these diseases based on our understanding of the disease. Because we don't have adequate understanding, the funding and the support for treatment of mental illnesses is paltry.
We have providers who are telling us we could serve more people and hire more clinicians, which means more jobs in the local community. We could do more if you could give us more money, and we are desperately trying to do that, but we're giving all the resources we have out to them already.
Cook believes the state's mental health court system is one area that desperately needs more funding.
Mental health court is a place where when someone gets arrested and they go to jail, they can actually have a mental health evaluation done. If that person is deemed as not competent at this point, their mental illness is severe and they are not making decisions on their own. Their illness is causing them to make bad decisions. Then what can happen is instead of staying in jail, they can actually go into the mental health court system.
The data from mental health courts bears out their effectiveness.
We've seen over a 90% decrease in unemployment. What we've also seen is a huge decrease in law enforcement contacts. So for less money, people are getting jobs and they're not coming in contact with law enforcement as compared to those who serve a prison sentence and then are released afterwards. We have district attorneys, judges, counties who are on the waiting list wanting to start a mental health court, but we don't have any more resources to give them. So there are people going to prison every day who could be better served by being served for less taxpayer dollars and have better outcomes if we had more mental health courts.
Because of a lack of funding, Mental health courts operate in just 14 of the state's 77 counties. The legislature has begun to funnel more resources toward mental health. Lawmakers last year gave the Department of Mental Health and Substance Abuse Services a $16 million boost in appropriations. But White says that doesn't make up for decades of underfunding.
We're serving more Oklahomans today than we have before, but there are still so many going without, and it's costing us in terms of lives, it's costing us in terms of taxpayer dollars, that I wouldn't be doing my job if I didn't say, we are grateful for what we've been given, and we know there's other priorities out there, but we still need more, or we're really going to pay for it as Oklahomans.
In order to avoid cutting services this year, White says the agency needs an additional $21 million over last year's budget.
And I know that sounds like a lot, but the fact is we have to pay for certain things, like our grant matches, like the Medicaid rate matches. There are certain requirements that we have that have been placed upon us that are going to cost us $21 million more next year.
State agencies have been warned to expect flat budgets next fiscal year, but White argues her agency can't tighten its belt much further.
Over 97% of our budget is out in the community serving Oklahoma families. We don't have a lot of places to cut. So when we talk about flat budget, we're talking about having then to cut $21 million out of the service system. That means undoing all the programs that have been put in place over the last 3 years and all the progress we've made, or cutting 7,000 people, some of our state's most ill, out of services.
White maintains cutting services would cost the state more in the long run, but admits chances for a funding increase appear unlikely. Due to a decline in general revenue collections, the legislature is projected to have about $171 million less to spend in the coming fiscal year.